Hello, welcome to the new edition of JDC Diabetes Gems video, where we are going to discuss about type 1 diabetes. Type 1 diabetes, as all of you are well aware, is the diabetes most prevalent in children. Unlike type 2 diabetes, in type 1 diabetes, there is a genetic factor which is strongly involved. However, for the expression of that genetic factor, some environmental triggering factors should be available. In a genetically predisposed child, when there is a viral infection or autoimmune process going on, gradually type 1 diabetes sets in. It is primarily because of autoimmune destruction of pancreatic beta cells which secrete insulin. In other words, type 1 diabetes subjects, whether children or adolescents or adults, will have absolute insulin deficiency. The incidence of type 1 diabetes when compared to type 2 is less. In India, only 4 to 5% of the total diabetes is type 1. However, considering the population of India and 40% of our population below the age of 18 years, the actual numbers with type 1 will be much higher. The diagnosis of type 1 itself is a shock to the whole family. Unfortunately, it is a difficult to treat diabetes. The sugars will go up and down. The risk of hypoglycemia or low sugar is high compared to type 1. The chances of high sugars resulting in ketoacidosis is also high compared to type 2 diabetes. In type 1 diabetes, the children will require multiple insulin shots, 3 or 4 injections per day. The ideal treatment is with insulin pump. Whatever be the treatment option, patients should monitor the blood sugars several times daily, 4 to 8 times daily. So there are more than half a dozen challenges in the management of type 1 diabetes. That is the fact. But we need to treat type 1 diabetes as a team, not as a doctor and a patient together. The management of type 1 diabetes is with the child, with the mother, with the father and other family members working in unison with the diabetes physician, the nurse, the educator, the dietitian and the psychologist. The management of type 1 diabetes requires the support of a psychologist or a counselor because of the multiple psychosocial factors involved. How will you treat type 1 diabetes? I have already said that the ideal treatment is with a rapid-acting analog insulin like Novorapid or Epidra or Humalog, given with the help of an insulin pump. The same rapid-acting analog will provide both the basal requirements and the bolus requirements. But all patients are not motivated. Only a few patients can afford insulin pump therapy, since in India there is no reimbursement policy yet available. So now we have the injections like the long-acting glargine and the rapid-acting analogs remain. So it is 4 or even more injections per day. The rapid-acting injections are ideally administered 5 or 10 minutes before a main meal. But in small children, where you don't know how much they are going to eat, the rapid-acting insulin can be given even after food. Frequent self-monitoring of blood glucose or with the help of parents or the teacher at school is required to measure the amount of insulin which is required each time as a bolus. Whereas we can keep the long-acting detemir or glargine at a constant dose. The time of puberty is again a challenge. The insulin requirements will go up. It can be much higher than the previous dose. And during that period, the child should be motivated, should be educated, and the diabetes team should help along with the family members to cope up with the situation. Depression is common among children. Agitation is common among children. Violent behavior is common among children, and these have to be tackled. In the management of type 1 diabetes, team is important. We should work as a team. There are a lot of new devices and technologies made available, like the use of continuous glucose monitoring, integrating insulin pump with CGM, the real-time pumps, the VO pump which has got a low glucose suspend mechanism which shuts down before the onset of a low sugar, and the newer clinical trials ongoing with the invention of an artificial pancreatic system where we are going to close the loop. However, at the present scenario, the success in the outcomes of the management of type 1 depends on motivation, education, selection of right candidates for technology-based therapies, integrating the management with a multidisciplinary, highly trained professional team, and of course, education and motivation of the family members. So, we should be treating type 1 diabetes. The challenges with the glycemic variability and the high A1C values. Anyway, go by the age, go by multiple parameters, and all patients and the caretakers at home with type 1 diabetes will realize that though a difficult to treat diabetes, a normal or near normal life is possible, and there are no barriers to a normal life for a type 1 diabetes patient. Science has advanced a lot. Thank you very much for your patient listening, and we are extremely thankful to our GEMS viewers for your positive feedbacks and comments. Until next time, goodbye from JDC Diabetes team from Kerala.